Hi, I'm Dr. Jay Harness from Breast Cancer Answers. One of the important questions I'm asked is, hey, Dr. Harness, what is a prophylactic mastectomy? Well, before answering that question, we'd like to take this opportunity to thank our sponsor, Breast Cancer Index. It's a test that may help women with estrogen receptor positive, early stage breast cancer to decide with their doctors whether to extend or end anti-hormonal therapy after 5 years. Well, the term prophylactic mastectomy is the same as a preventative mastectomy. In other words, what we're doing is removing, to the best of our knowledge, perfectly healthy normal breast tissue as a way of trying to prevent the development of a breast cancer. Now, the one strong indication for doing prophylactic mastectomies is in patients who are BRCA1 or 2 gene positive. The perfect example of this is Angelina Jolie. In that case, Angelina Jolie knew that she had about an 80% chance of eventually developing a breast cancer over her lifetime, and she wanted to prevent that by prophylactically removing her breast. She used a technique called nipple-sparing mastectomy, or that's the technique her surgeon used, which in my view is the preferred way of doing preventative or prophylactic mastectomies. Now, I've been focused on breast cancer for now 31 years. I began in an era where we worked very hard with lumpectomy and saving women's breasts instead of everyone having a mastectomy. But what's happened over this last 10 years or so is that more and more women are choosing mastectomy, quite frankly, probably out of fear and not necessarily because they're gene positive. This is particularly true in women in their late 40s or early 50s, or even the occasional cases in their 30s, where not only are they doing mastectomy on the cancer side, but doing a prophylactic mastectomy on the other side. I can understand where they're coming from, but the reality is they're not improving their survival by doing such prophylactic mastectomies once you've been diagnosed with a diagnosis of breast cancer. Now, importantly, you need to remember that no breast surgeon on this planet can ever tell a patient that we can remove 1,000% of all microscopically normal breast tissue. That breast tissue exists from the armpit area all the way down to your upper belly. We certainly remove everything we can see, feel, and touch, and reduce the chance of a cancer coming by at least 95%. So that's the definition of a prophylactic mastectomy. Making that decision, you should be working with a qualified multidisciplinary team. And finally, we'd like to thank our sponsor, Breast Cancer Index. To find out more about your treatment options beyond year 5, just click the button and download our free list of 15 questions to go through with your physician.